I'm Dr. Keith Ryan, a chiropractor in Tulsa, Oklahoma. I wanted to talk to you about carpal tunnel and how chiropractors can help with that. Now, carpal tunnel is a repetitive type injury to the wrist affecting the medial nerve, because the medial nerve is what goes through the carpal tunnel. So really for your sake, it really affects thumb, this finger, and most of this finger. It doesn't affect the two fingers on the end. So if these are hurting, it's not carpal tunnel that's really bothering you, or you have a combination of things. But it's these three that are really the big culprits for what you have going on. So what are the symptoms that usually happens with that? Usually you can get some numbness in these three fingers, and then you usually have wrist pain associated with it too, or your wrist just doesn't move properly. Now, this wrist pain and these fingers can happen for a number of reasons. You can have the joints in your wrist not move properly, and there is joints, these bones move, and so if your bones in your arm and bones in your wrist aren't moving properly, it'll cause that carpal tunnel to become smaller, put pressure on the nerves, and then cause the symptoms that you have. So what do chiropractors do to correct it? One, they'll look at several different things. We know it's a problem with the nerves, so they'll look to see if the wrist is having problems, and they'll manipulate the wrist to open that up. But there's another kicker to the whole story that could be a problem. You can have along the course of the nerve what's called a double crush or a triple crush. What that means is you can have the medial nerves coming down from your neck, through your shoulder, through your elbow, and to the wrist that are pinched along the path from the neck. And then if one of those are pinched with a problem in the wrist, then it's called a double crush. If it's pinched in two different areas, then it's called a triple crush. And just the added pressure to the nerve along the way from being pinched can cause that problem. So chiropractors will generally look and see if there's any problem associated with that complete nerve root coming from the neck, the shoulder, the elbow, and in the wrist, and clear all of those out too. That's why chiropractors are so successful in fixing and clearing up carpal tunnel, because they take the source and all the different problems where it can come from and clear them up. So chiropractors will manipulate those areas, relieve the nerve pressure, may do some therapy on you to help bring down some swelling and inflammation, and they'll teach you some exercises along the way. You may have to wear some bracing and that sort of thing depending on how you got your carpal tunnel to help protect it from being injured. But in general, chiropractors are pretty successful in correcting this. Hope this gives you some ideas on how to treat your carpal tunnel. Thanks.